Hey there, welcome back to the Next Level NP podcast, where we're transforming women's health one conversation at a time. I'm Marcia Jones. I'm a nurse practitioner. I'm certified in functional medicine. And after 30 years in healthcare and finding myself on the other side of the exam table as a patient, I realized that too many women are being told they're fine while their bodies are actually telling them a very different story. So, this podcast brings together women with powerful stories and practitioners who are willing to ask the deeper questions because your story matters, your symptoms matter, and healing begins when someone actually finally listens. So today's guest is someone that I immediately connected with because our philosophies are very similar. We both believe that women deserve better answers, but we also believe that healthcare doesn't become a choice between conventional medicine and functional medicine. It can be both. So today I'm joined by family nurse practitioner Kacie Proctor. Kacie has spent years caring for patients in areas of emergency medicine, critical care, hospital medicine. She's done palliative care, primary care, and she's found a passion in functional medicine as well. So what I love about her approach is that she hasn't rejected conventional medicine, she's expanded on it. She believes that the best outcomes happen when we blend the life-saving strengths of traditional medicine with the deeper root cause approach of functional medicine. So today we're talking about what that looks like for women, for providers, and for the future of healthcare. So meet Kacie. Kacie, welcome. Please tell us a little bit about yourself, your journey through nursing, like how you've gotten here.
Yeah, thanks for having me. I'm really excited. So, as Marcia said, I'm Kacie. I'm a family nurse practitioner. I've been doing this for almost 10 years. This is year number 10 for me. And so, I was just a baby. I was 25 when I graduated. And my whole journey started. I actually wanted to be a special education teacher and a speech language pathologist. And I woke up one day over the summer and I called my mom. I was in school. I was about to enter the education program. And I was like, I think I want to go to nursing school. And she was like, wait, what? Like, this is a whole shifting gears. And she was like, I just don't know that you're going to like nursing. And I was like, well, I'm going to try it. So I did it and enrolled in the nursing program. And we have a very small college back home that I ended up transferring to. And I met with one of the advisors and my mom is a nurse. And so she knew my mom from school and just from the field. And she was like, you're going to be a critical care nurse. And I was like, I beg to differ. I'm going to be a labor and delivery nurse. And she was like, I don't think so. So went through school, got my first job in critical care. And I went back and told her, I was like, well, I'm going to be a critical care nurse. And she was like, I told you. Like she laughed and she was like, I told you. And so that is where I thought that like my journey would stay. Like I wanted to be a critical care nurse. I loved ICU. I loved CC. All things heart was like what I loved. I loved cardiac. I loved just that critical medicine. And then I was like, you know what? Let's go to the ER. My husband's a paramedic. I would always hear like his kind of fun stories. I say fun, like, all the big stories about what he did for the day. And I was like, I think I want to do ER. So then I went to the ER. And that was a whole different beast. But I still got to do the emergency medicine, still got to do the critical care, but it was a little more fast paced, which I kind of liked. And then I was like, you know what? I think I want to go to nurse practitioner school. And my husband's like, what? And so I did nurse practitioner school, and because I loved the ICU and the ER, I actually went into hospital medicine. And so I was a hospitalist. I would admit patients from the ER, and then I would also get around on them in ICU. So I was doing central lines. I was doing all the things. I loved it. And then I had a baby, and I was working 7 days on, 7 days off. 7 days off was great. 7 days on was terrible. And so then I was like, okay, let's do primary care. So I went to primary care and I did like a primary care urgent care thing. And I was still doing 12-hour shifts and it was great for a little while. And then I had another baby and I was like, okay, I'm out. Then I went to the nursing home, and the nursing home is where it kind of like changed for me. And I saw all of these just really, really sick nursing home patients that were uncontrolled diabetics. They were on 8,000 medicines and they were 90 years old, and they had, yes, risk factors, but like why are we just adding more and more and more and more to like our sickest population? And I remember there was one day in particular, there was a patient and I diagnosed her with Hashimoto's in the nursing home. She was a young patient, and I asked the dietary staff, I was like, hey, like there are studies that show gluten-free diets with Hashimoto's like have a profound impact on thyroid antibodies. And they were like, oh, well, she doesn't have a thyroid allergy. We can't, or a gluten allergy. We can't do gluten-free. And I was like, excuse me? And they're like, yeah, she doesn't have a gluten allergy. And I was like, but we have other things that, anyways. So then the wheels started turning and I was like, okay, I can't do this anymore. I'd already started my functional medicine certification because I had been failed by conventional medicine myself. But that was just kind of like the push that like got me out of the nursing home. And I was like, okay, I'm done. And so now I'm here and I'm doing functional medicine. I do primary care. I do kind of a mix of it all, and I get to blend it together, which is kind of what you were saying, that there doesn't have to be an either or, there can be a both and.
And you know what I love? Like, our stories really are so similar. The best thing about this profession is you can do whatever you want.
Mm-hmm.
Like, I did the same. I started in a nursing home as a nursing assistant. So I saw that first. And then I went into a doctor's office, and then I was like, I'm going to be a nurse. I'm not going to just be a nursing assistant. I'm going to be a nurse. Went back to school. Yes, ER was actually my first experience. And I loved it. I
Yeah.
loved ER nursing. Never would have dreamed that I would have a primary care practice or that I would do functional medicine. But like you said, like the more you see in the career, the more you start putting the pieces together and seeing where these gaps are. And there's a place for everything.
For sure.
But it's the more gaps you see, I think the more it pushes you to do something else. But again, the greatest profession ever because we can. We can. We're not stuck. And that I love that we're not stuck. So tell me though about now primary care. So what you do right now is an integrative practice, we'll call it.
Yes. And that is the best way that I like to, because I want to be set apart from primary care. I don't just want to be another primary care provider. I want to look at things from a holistic lens and I want to look at things from a conventional lens. And I feel like that is where patients really thrive. Prime example, I have patients that come to me on a pretty daily basis and we look at, I say basic labs. I never look at basic labs, but I start with a comprehensive panel. And so if their story doesn't quite line up based on what I'm seeing on labs, I get to ask deeper questions. And I feel like that is where I'm set apart from other primary care providers because I make my own schedule. I am able to work with patients in a capacity that I don't have to see 30 patients a day. And it's really nice because then I get to ask those deeper questions. I get to ask you about sleep and nutrition and bowel movements. And I don't know about you, but the last time I went to the doctor, I didn't get asked about any of those things. And so I get to do that. I get to be that voice for people. I get to ask those deeper questions that help them figure out why behind their symptoms.
So tell me, one of my big aha moments, and I always tell the story, when I first started with functional medicine training, the very first meeting was that I attended, I was like, the sky opened up and the angels were singing. I'm like, why wasn't it taught like this before? Because you started to, and people think that functional medicine is, I've heard it called everything, like that's just witchcraft or that's just a bunch of supplements, but it's not. It is so deep. And so how was your experience when you first started with functional medicine? Did you have that like, this is where I belong, this is the difference?
For sure. It was literally like you said, it was like the heavens opened up and the angels started singing. It was like, this is it. And then I get like my first few patients, and I worked with like family members. So I was very nervous about like putting this out there because like you said, there's so many what is the word I'm looking for?
Misperceptions.
Yes. She's a snake doctor. She's a witch doctor. She does this. She does that. She does oil. No. So I was really nervous to put it out there, but I started working with myself. I started ordering tests on myself that nobody else would order. And I'll be honest, I didn't have the money to go to a functional medicine provider. I just didn't because all the ones in my area were super expensive and I had just paid for school. I was still paying on school rather. And so I had babies at home. I just didn't have the means to pay to go see this big expensive functional medicine provider. And so I just started kind of being like, what can I do for myself? And so then I started working with family members and I would order testing on them. And so as I was working through my functional medicine program, when it came time to pass my certification, my case study, I was like, which patient should I pull from? Because as I was learning, I was working with them. And so, it was really nice to be able to, like you said, just have that aha moment where I was like, this is what so many people are missing. And unfortunately, a lot of people just don't know about it or they have these preconceived ideas about it. And it's just so much more than I feel like what most people know.
And, so as nurses, to be a nurse practitioner, you have to start as a nurse. We've done a lot of the bedside care. We've done a lot of that, hand holding and get a different view on the patient. So I think that's where functional medicine for nurse practitioners really is that sweet spot because we've done that. And so listening to the story, but in a different way, is how it all comes together. And so I always say that the story matters. And that's why in
It
this
does.
podcast, I'm bringing together patient experiences as well as practitioners, because like you had said your own journey, and I'd love to hear a little about that, because that's how I found functional medicine. I did all the things, I was this type A typical nursing student that I did everything by the book, like I had to get straight A's. I had to follow the protocols. I had to, like, I was a by the book kind of person. And I thought that I was doing women well, like I listened to them, but I was still ordering the test. Never did I think about ordering hormones. That was never discussed. But I would still do all the things like, okay, well, you have this. Let me give you Zoloft. Let me do this. But they would always come back and they still weren't quite right. And so I would listen to their story and I thought I was doing them a good deed, but I was not. And then I found this out really because, again, my own journey. I remember I went through nursing school. I did all the things and I had my own practice. I was at the pinnacle of my career. I should have been happy and perfect, right? But instead, I'm sitting at my desk like, if I have to go down that hallway one more time, I just cannot get myself up out of this chair. And I'm like, what is wrong with me? I went to all the specialists, all the colleagues, all the things. And everybody's like, well, maybe you just need an antidepressant, which actually ticked me off. I was so
Mhm.
mad. I was like, are you kidding me? Look at what I have. I'm not depressed. All my dreams have come true. But through functional medicine, finding that, learning the story, all of the years that got me there were actually what was wrong. It was, well, now we call it HPA axis dysfunction, but it was burnout. My adrenals were tapped. So my blood sugar was dropping, didn't realize that. No one had ever checked an insulin level. At one point, I had a GGT study and my blood sugar was 23. So, but I had to tell the person what to order. I was like, could you please just order this test? And thank goodness, we had worked together for years and he's like, fine, Marcia, I'll order the test. And then when he got the number back, he's like, okay, whoa. But still didn't, it was then I go to an endocrinologist, then I go to audiologists and none of them. So anyway, then I found first hormones, which temporarily improved how I felt, but it didn't address the root cause, which was the HPA axis. That is what I found out in functional medicine. So the story led to the root cause that was only being, placated by using hormones. So then I had to go down through the journey of working on the adrenals, and then it all came together. And that's why I said the story, and so many women are suffering through this. And if I hadn't had to go through it myself, I never would have known. And these women can't advocate for themselves because they don't know. If I, as a provider, didn't know, they feel like they're losing their minds and there's
Mhm.
no way to advocate. Have you
Yeah.
found that also? Is that
Yeah, I literally just had a patient in my clinic, not yesterday, but the day before. And that patient was in absolute tears. And she was like, I just feel like I'm broken. Like, I feel like I can't fix me. I feel like nobody can fix me because nobody's been able to find anything wrong.
Mhm.
And I'm like, well, that's why you're here. Like, that is what I'm here for. And I have recently started like digging into like, dexamethasone suppression testing to look at those adrenals, to look at, cortisol levels. And I hate blood cortisol levels because unless you're sleeping in my lab parking lot, like you have to have those done within 30 minutes of waking up.
Yes.
But, the dexamethasone suppression test is a great way for me to think outside the box too. And so I've really been like digging into that. So I've ordered that testing for her. And so it is really just a way where I can take what people are saying, I can digest it, and in turn, I fight for them not to feel broken. Like, because the thing about it is yes, something is broken now, but like it doesn't have to be broken forever. And my job is to figure out what is broken and why it's broken and address that, just like you said, from a root cause level. Because you can put band-aids on stuff all day. And that is my philosophy is if you need me forever or if you're on supplements forever, I have failed you greatly because I don't want you to need me forever. I don't want you to be reliant on supplements forever. I want to heal what is causing all of this and get you out my door. Like, I love you, but I don't want to see you forever.
Yeah.
Unless it's from a primary care standpoint, then yes, great, come see me. But I don't want you to need me from a functional medicine standpoint forever, because I have failed you if you are recurrently just coming back to me year after year after year after year because this is fixed, but now this is broken. This is fixed, and now this is broken. Like, let's address it all. And it may take years. Like that, I'm not saying you're going to get better overnight, but like, if you leave from me and then you come back to, like, I feel like then I've not addressed what's really going on, if that makes sense.
How do you find the woman's response when you actually listen to her story and give her hope?
They cry. And I cry. I am like the biggest empath. Oh my gosh, I'm like the biggest empath I feel like I've ever met. And so, like, when this girl was crying, I was like, and like trying to like hold it together. And I try not to show emotion because then it makes them more emotional. But then, like, their stories, and I feel like because I have felt the same way, I felt very defeated, I felt very broken. I feel like I can resonate with that, but I also have like the empathy. And so that's where the empathy comes in. But then I feel like I also have the knowledge to like fight for and ask the questions that and order the tests that nobody else is ordering.
And that's what I think why they cry. I was like, I never used to be a crier until this whole perimenopause, menopause. I'm 51 now, and it just kind of happens.
Yep.
So, but yeah, it's great. But to see the emotion out of someone who finally gets heard, that has a path forward, and when you're honest with them and say, "Listen, I'm going to look for this. I can't promise that I'm going to fix you overnight, but we're going to work on it." And then trying to wean off of medications instead of adding more medications. And it is such a rewarding way to do it.
It is. And one of my favorite patients, I talk about this a lot, is she's in her 40s. I can't remember an exact age right now because I don't have her stuff pulled up. She's in her 40s. She's a nurse at a local hospital near me. And she came to me as a referral from a supervisor doctor in the area because he was like, I'm done. I don't know what's wrong. I don't know what else to do. I don't know what's wrong. But she is having 30 loose stools a day. She is waking up in the middle of the night having diarrhea. She's having fecal incontinence. She is losing profound amount of weights. GI did a scope on her last year. It was completely normal. And so she comes to me and she tells me her story. I'm making notes as we're going along. And then I'm just really honest. I was like, because I've done IBD certifications, I've done different gut certifications because that is really where my passion is. And so I've done several different gut certifications. And I was like, I have a book. I'm going to need you to give me a minute. I need to go because I can look based on symptoms in this book. And so I went to like nocturnal diarrhea because that was like the biggest thing that stood out to me was this nocturnal diarrhea. And so I went and I looked it up and it started just naming off these like differential diagnoses. And so I was like, So I go back and I'm like, when GI did your scope, did they do biopsies? And she was like, no. And I was like, why? And she was like, they said everything looked good. And I was like, what? Of course it looks good. And she was like, what are you worried about? And I was like, well, could it be inflammatory bowel disease? Fast forward 3 weeks, I got her GI map back and her calprotectin was 1,300.
Oh,
And I was like, So back to GI we go, but we went to a different GI doctor and he got her in rather quickly. We did a EGD. They took biopsies. They did a colonoscopy. They took biopsies. But I had like functional medicine ranges that I could advocate for why she needed a repeat scope in 5 months. Or calprotectin's 1,300. And he was like, yeah, that's not good. And her occult blood was off the charts. So long story short, we now have a microscopic colitis diagnosis that was missed. And now she's gaining weight. Now she has 2 bowel movements a day. And it's like, so that's where she is on steroids. Like, but again, that's where you blend conventional and functional. Like, if I wouldn't have had these numbers to advocate, they wouldn't have scoped her again. She just had a scope. They wouldn't have.
right.
So that's where you have to blend both. And I feel like that is where so many people can't think outside the box. And so many providers, like, her original GI doctor, their office dismissed one of my patients because they don't believe in what I do.
I was going to ask
And
that question. Yeah.
so that is why I said, if you're going to work with me, we're going to have to find a different GI doctor, because their office has said it can be either or. It cannot be them and me. It can be me or them. This other physician's office refers patients to me when they can't figure out what's going on. And so I called this doctor on the phone and I was like, hey, so and so, I've got this patient. He was like, can she be in my office Friday at 1 o'clock? I don't remember the time, but it was like, I saw her on a Tuesday. She was in his office by a Friday and was scoped 2 weeks later.
We have so much work to do, so much education. And I always wonder, like, how are these people going to feel in 20 years when all of this has become mainstream and they thought we were crazy? So, okay, I'm glad you brought up the GI map, because you were like the queen of gut health. You know, look at you, get so excited. But so I see that also. I have providers here, colleagues, that either I'm called that woman because I do that stuff, or they're intrigued and they're like, well, tell me more about this. So you already talked about, you get the same thing, but tell me how the patients feel when you start talking to them about their gut health and what you see with treating gut health.
So, of course, the first response is, you mean I have to do what? I have to do what? And I'm like, you'll never look at a Carnival fry container the same ever again. I can promise you that. I was like, I can never go to the fair and ever get a basket ever again. Like, thanks, but no thanks. So originally they're like, yuck. But then they do it. And then, like, the light bulbs that click, because I will literally go page by page. I will go organism by organism. I will go number by number down that GI map, and I will correlate it to their symptoms. And I'm like, well, this causes diarrhea. And they're like, wait, what? And I'm like, this causes bloating and this causes histamine reactions. And they're like, oh, I didn't even tell you about my histamine reactions. And I'm like, but I can see it here. Like, I know that you're having histamine reactions because this bacteria is significantly overgrown. And so I feel like the initial response is gross. The click that it does when I correlate it with their symptoms is great. And then, of course, there comes the overwhelm. Well, you mean to tell me I have to make dietary changes? I have to do this. I have to take this supplement. I have to do it this many times a day. And I'm like, but if I can get you feeling better, like, this is a temporary discomfort for long-term comfort, long-term like gain. Yes, some of my kill protocols are way heavier than others, especially if they're not used to being on supplements. Like, yes, it can be a lot. But then when they come back to me, I had a lady, I talk about her too. She owned a pest control business, and she told me, I can't pass gas and I have to plan my day around a bathroom because I'm constantly having explosive diarrhea all the time. I can't go out to lunch with my colleagues. I can't do anything. And so I started addressing those imbalances in her microbiome. And she texted me one day and she was like, I went out to eat with my colleagues today and I was able to make it back. And even when I made it back to the business, I did not have just explosive diarrhea. And then she texted me a few weeks later and she was like, I farted in front of my husband today for the first time, and I can't tell you how long. And I was like, well, for me, like, my husband and I are very private people. So to me, I was like, good. But like, that was one of her concerns. Like, she couldn't do this. And so, like, when those light bulbs start clicking and when like the pieces fit together, like, that aha moment is just one of my favorite things.
And so I don't want to say more with the gut health because it is so fascinating. There is a connection, and I don't want to go down that pathway on that because I want to talk about some other stuff, but there is a connection between hormones and the gut. There is an actual section called an estrobolome that has to do with how your estrogen is processed. And again, I don't want to get too deep in things, but you know, your beta glucuronidase, there's all of these things inside of that GI map that will give you what's really happening. And I used to order a Dutch test on a lot of my women first when we were doing hormones and breast cancer. And actually, I have stopped doing that as my first test and started doing a GI map if they need a specialty test, because I can do more with the gut first, then dive into their detoxification pathways and the other things that are happening and make them feel better faster. Because there are so many women who are running around here that go to the bathroom once or twice a week. And of course, as the nursing profession, we talk about poop. Like, it's our thing. But why is it you think we ask that. Okay, that's a nursing thing. You go down, did you have a bowel movement today? Did you have a bowel movement today? But yet, once we get into the primary care realm, we're not asking about bowel movements. And if somebody says they're constipated, why do we just give them something like Linzess or like, do you have any
Miralax.
fiber in your diet? Oh, yeah. Like, is there fiber in your diet? But when I tell women, and I don't like scare tactics, but I'm so upfront with my women. Then I'm like, yes, I'm going to ask you about your bowel movements. Please don't think it's embarrassing to tell me because it's what I need to know. But if you are not going to the bathroom every single day, your risk of breast cancer is off the charts and colon cancer. And you're not going to process your estrogen. You're never going to feel good. You're going to have anxiety. And I talk about neurotransmitters and all the things. And they'll be like, okay, 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 I'll poop in your fry cup. Like,
Huh?
whatever.
Yep,
I don't want cancer. Well, it's so overlooked.
it is. And it's so sad too because a lot of people don't ask those questions anymore. And a lot of women don't know. And if you're like me, I'm very private, so I don't want to talk to anybody about my poop. But like at some point you have to, because again, like you said, if we are not going every day, like that is our one of our biggest detox pathways.
Hmm.
And so if you're not detoxing, you're holding on to toxins all the time, and then they're just recirculating.
And then you want to talk about the toxins and inflammation in the body?
Yeah, let's do it. That is going back to Dutch test. That's one of the biggest reasons I like a Dutch test versus just conventional blood labs is because, okay, your estrogen is low. Fine. I can give you an estrogen patch. We can do an estrogen pellet. Like, I will not ever, 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 and you can put this on my grave. I will never give somebody a synthetic estrogen pill. Don't ask me about it. If you ask me about it, thanks, but no thanks. So that is a hill I will die on.
Me too.
And anyways, that's part of the reason I love a Dutch test is okay, your estrogen is low. Great. I can fix your estrogen. But if you are recycling the estrogen that I'm giving you, well, now we're at an increased risk for estrogen dominant cancers. And so we need to fix that estrogen detox pathway before I can ever replace your estrogen, because then I'm doing you a disservice by putting you at an increased risk for that late. Like there's so much that goes into it that people are just quick to prescribe this, to do this, to do this, and nobody ever asks why.
Exactly. And that's one of the, like, I mean, this isn't all about talking about my programs, but I do. So, Next Level NP, part of what this started is because I was in traditional healthcare, I have functional medicine, I'm trying to bridge the gap. Okay, everybody's asking about hormones. And let's see, we'll touch on this in a minute, how you feel about influencers trying to tell people what to do. You
Mm-hmm.
know, like, you go take a weekend course or you hear that like the black box warnings off of estrogen now, and all of a sudden everybody's prescribing it. They're not feeling any better. Yes, cancer is going through the roof, but this is where I think we've got issues with being respected. And because there was the studies, like you said, on the oral, that's a whole other topic. The oral estrogens, all the studies were wrong because they didn't look at the basics and the foundations. So that is what I'm teaching because I've seen all these women come to me with or just put on hormone patches, or there's two sides of the fence, and I'm sure you see this too. It's either I'm not doing that, it causes cancer, or I wasn't trained in that, so no, I'm not giving you. Go find one of those other people. Then you've got the providers who are like, yeah, sure, I'll give it to you. But like you said, they're not asking, are you going to the bathroom every day? So I'm giving you this estrogen, but is it recirculating because you're not detoxifying? All the questions aren't being asked. So what I really want to do in bridging that gap is teaching nurse practitioners, which of course I think we're the best profession because we care and we love,
Right.
but teaching nurse practitioners like, okay, don't just give that estrogen. Start asking the questions because your patients are going to thank you and you're not going to be in a, God forbid, a lawsuit later on because they developed cancer and said, well, it had to be what you gave me, and that's why I have breast cancer. No, estrogen itself doesn't cause breast cancer. A detox pathway that's broken will increase your risk for breast cancer. And I don't know how long it's going to take us to get past those misconceptions about estrogen cancer because estrogen has so many other wonderful things it does in the body. I'm very comfortable prescribing estrogen. I'm very comfortable explaining it to my patients why estrogen is okay for you if XYZ. So that soapbox, I'll leave that one alone for a minute. But so, how do you feel about influencers and little 20-year-old, I shouldn't say that, will get me in trouble, and younger TikTokers who are telling women in perimenopause and menopause what to do with their health?
It drives me a little bit crazy. And, I'm not an influencer. I feel like I'm not a viral influencer. Like, I have influence because people trust me, right? And I'm not just some blowjo on the side of the road who is trying to influence all these women. Like, the people who listen to me is because that they trust me. And so I have to be very careful about the information that I share, and I have to make sure it's factual. And I feel like that's where so many people fall short on this influencer realm, is they are just going on ChatGPT and they're like, this is a hot topic right now, talk to me about it, like, tell me something to say about it. And they have no idea anything about hormones in older women. They have zero medical degrees. Same thing with peptides. Like, all these influencers who are like, go to this website and get your peptides. Like, no, you should get them from a reliable source if you're going to get peptides. Same thing, all these companies and these GLP-1s. And I'm like, can we get them from reliable sources if we're going to get them? Like, what do you mean to tell me that a non prescriber is now getting a kickback from some of these companies on
Yeah.
hormones, on GLPs, on peptide? Like, what do you mean that Sally Smith can recommend a GLP and make hundreds of thousands of dollars because this company is paying? It just makes no sense to me. It absolutely is infuriating.
Nobody asked about pancreatitis. Nobody
Right.
asked about any of the other medullary thyroid cancers or any of the other things that could possibly go wrong.
No, they
And what
just,
about what they're compounded with? You don't even have a clue. I had a patient come into me, she lost like 30 pounds. So I instantly knew. If you've been struggling with your weight and you come in a 3-month follow up and you lost 30 pounds, I said, "Oh, what did you do? And how'd you lose the weight? I'm so proud." And she was like, "I don't want to tell you." And I said, "I know you're doing a shot. You have to be doing one of the shots. Where are you getting it from?" Like, I went through I'm like, "I'm not judging you. I want to make sure you're safe." She's like, "Well, I found this one that it's like everybody else wants thousands of dollars." And she said, "It's $150 a month." And I went, "What are you taking? Where are you getting this from?" Because I knew instantly if she's getting it for under $300 a month, for sure, it's not safe. And her answer was, I don't care. I want to lose the weight." And I was just like, how do I help this woman understand what she's going to do to herself?
yeah. And they're so desperate for answers. So they're willing to try anything. I don't care where I get it from.
I really see a crisis coming after GLP-1s. Again, it's another whole topic. I'm an advocate if they're used properly,
Yes.
from the right source, for the right reason, at the right dosing, just like any type of medication. But I'm so afraid that we're going to end up like the whole fen era where everybody was doing that. And then they found out there's all these cardiac problems because it wasn't used correctly. And so now we have, God only knows what they're injecting into them that's going to come back and bite later on.
Yeah. It's really scary. And that's, we do prescribe GLP-1s at the clinic that I work for. And, I always have my same soapbox, is it is a tool in our toolbox, but it is not the toolbox. Like, you cannot have a crappy diet and just take this medicine and expect that it's going to work. You cannot. I prescribe it more. When I do prescribe it, I prescribe it more for inflammation. So I'm going to look at your inflammatory markers. I'm going to look at your insulin numbers. I'm going to look at lots of different things before I will just say, hey, here you go. I'm going to make sure that the questions are asked. I'm going to ask you about your diet that you're currently doing. And if you're just eating trash all day, like, I'm going to tell you we should probably fix your diet first. Then we can look at adding on a GLP or something like that. I do not eat a bad diet. I personally take a microdose of a GLP and it keeps my inflammation at bay. So I'm not against it. I can't be against it because I personally do it. But I don't take a weight loss dose. And I literally have cleaned up my diet so much. Because again, it's a tool in my toolbox and I use it for inflammation. And in turn, inflammation, when I decrease it, leads to weight loss. And weight loss leads to feeling better. And when I lose weight, my insulin numbers get better. Like it is a tool. It is, but it is not the end all be all. And that's what so many people, oh, well, I take a GLP, I'm fine.
I see too many people using it just to not eat. And
Yeah.
it drives me insane when I see them sitting there eating a Reese cup, and it's like, okay, no, that's not and that's why your hair's falling out, because now you're iron deficient, you're nutrient deficient. Like if we're going to do this, we have to do it the right way. And yeah, I'm very strict about it also, because I'm not going to just, like I said, I think it's a great tool, but it's not going to be just to lose weight because you want to look better in your bathing suit. So we kind of got off what was your story? What was your story where you healed yourself?
So I was pregnant with my son in 2021. He was born early 2022, and I had breast implants. And I was one of these people. I was like, I'm gonna be fine. I was fine. I got them in 2012, had zero issues. And then I was pretty active. And with my son, I was still doing CrossFit type workouts. And there was one day, and I can't remember the exact, how far along I was during pregnancy, but I was doing modified push ups. I might have even been doing like ring dips, like with the rings at the CrossFit gym. And I woke up the next morning, went to get in the shower, and I was like, that doesn't look right. And my implant had deflated. I had saline. So in my mind, I was like, it's just saline. It's fine. So I called my plastic surgeon. He was like, nope, you're good. We can't fix it while you're pregnant. And I was going to get it fixed. We can't fix it while you're pregnant. Come in, let me drain the other one. So he hooked it up to suction. He drained it. But the amount of inflammation that suddenly came up, the amount of gut issues that suddenly surfaced, the amount of rosacea that I had on my face, and some people were like, well, you're pregnant. And I was like, yeah, but this is not like pregnancy changes. This is like, I feel something in my bones that doesn't feel right. So Brody was born in February of 22, and I breastfed for a little while and wanted to do, all of the stuff before I ended up getting my implants redone. I was still going to get them redone. And then I started literally one day, I opened Instagram or TikTok, and I try not to get on either of those a whole lot for medical stuff. Like this sweater came from TikTok, so I will buy stuff from TikTok, but I try not to get on it for medical stuff, right?
Yeah, please don't.
Yeah, please don't. And all of a sudden one day, this person popped up and they were talking about breast implant illness. And I was like, And so I just started researching. And I started asking questions to my doctor. And I was like, is this a thing? Absolutely not. You should get them redone. Absolutely not. That's not a real thing. It's a fake thing. You should get them redone. Okay. So then, of course, as I start researching, then I start finding that there are cancers that grow inside the capsules. And it is not a breast cancer. It is a type of lymphoma that grows inside the capsule that houses your breast implant. So it is breast cancer in the sense that it's here, but it is a lymphoma breast. Anyways, so then I started researching. So then I was like, okay, I just want these out. Get them out of me. I'm done. So then I go to 6 different doctors to talk about explant. And they're like, oh, well, we can't remove the capsule. What do you mean you can't remove the capsule? It's too delicate. If you don't have a capsular contracture, we can't remove the capsule. And I was like, okay, but I want it gone. Well, it's too tedious. It adheres to your rib cage and we might puncture your lung. But I want it. I understand the risk, but I want them gone. Well, sorry, we can't. Okay.
Wow.
Next doctor, same thing. Next doctor, same thing. Finally found a doctor in Atlanta who specializes in breast cancer patients. So is very meticulous with very he doesn't do the mastectomies, but does the reconstructions and things after that. And so, yes, he still puts implants in, but he was on this breast cancer or breast implant illness Facebook page, and he would take out the capsules. So I went to him. He was like, yes, the capsules need to go. So long story short, I did that, got everything taken out, and almost immediately 85% of my symptoms got better. And I was like, okay, so maybe there's something to this, but the gut stuff was still lingering. and it would still be, and backstory, I have Hashimoto's. I've had Hashimoto's. I was diagnosed when I was 14 and I was put on medicine when I was 14. Had my gallbladder taken out when I was 16. So like I've always had gut stuff, but it got worse when my implants ruptured. So implants got out, capsules came out. That stuff got 85% better, but the gut stuff was still just, I would bloat really bad. I would do this. I would never have a consistent bowel movement from day to day. Like one day it would be constipation, one day it'd be a diarrhea, one day I'd skip. Like some days it would be 5 in one day, some days it would be 0 for 2 days. Like it was never anything to be consistent. So that's when I kind of was like, okay, well, let's just see what this whole functional medicine thing is about. And I don't remember how it came about. Like I don't remember, like there was not a profound moment where somebody just said, hey, you should look at functional medicine. Like it was just a matter of, I was neck deep in research trying to figure out what was wrong with me. And I saw something about gut and I was like, how do I order a gut test on myself? And so then it was like, well, if you are, and again, I'm Googling because I don't know anybody in this realm. And so then it's like, oh, well, you should find a functional medicine provider. So then I'm calling places and they're like $10,000, $6,000, this. And I was like, yep, can't do this. How do I order one on myself? So did that, set up, because I was a provider, set up a clinical consult with this company to go over my results. And then that was really the trajectory that like sent me down this path. And then again, I started healing my gut. Dove into hormones. Mine surprisingly weren't terrible, but I did have some cortisol dysregulation, HPA axis issues that were going on. And so then I just started connecting the pieces and I was like, if I can do this for me, what can I do for other people? What are other people missing? And then it was just fate from there.
And it all went from there.
And it all went downhill, or it all went uphill. From there. Yeah. And you know, the great thing is, and I have to be very careful about telling patients my Hashimoto story. So I was diagnosed at 14. By the time I was 22, I got married when I was 22. So 21, 22, I took myself off of medicine because I was like, I don't feel any different. I don't feel any better. I don't feel any worse. So I took myself off of medicine. I'm 35. So this was way before I found functional medicine. So healing my Hashimoto's was, I don't know if it was a temporary thing that is now part of my history forever because, you know, I was on medication. I had the diagnoses. I had the antibodies. I can't tell anybody what healed it or what put me into remission because at the time I didn't know. Mm-hmm. Now I know what I know. And I love working with Hashimoto's people because it is a lot of leaky gut. It is a lot of H. pylori. It is a lot of gut health stuff. So now I know, but I didn't know then. So I have to be very careful telling people, oh, well, I'm in remission. Well, get me in remission. Well, I don't know what I did like back then, but now I know what I know and we're going to try. Like,
you have a gluten intolerance?
On my GI map, okay, it depends on where you look at it. On blood work, I had a mild wheat allergy, but my zonulin was over 500. So was my gluten blood test, was my wheat blood test elevated because I had a leaky gut? Maybe, and I was eating a lot of gluten. On my GI map, my anti-gliadin was not terrible. It was greater than 50, and ultimately I want my patients to be less than 50. So it was never in the red, but I will say when I don't eat gluten, I feel better. Like I don't have the rosacea, I don't have the joint pain. So I do these like gluten-free periods. I don't stay gluten-free because I don't have a documented gluten allergy, but I feel better when I'm gluten-free. And then I try to reintroduce it and I see how my body does. And then I take it back away if I don't feel better. Then I reintroduce it. And so now I can handle certain things that don't have added gluten. So like I can handle pasta. My body still prefers a gluten-free, like organic type pasta, but I can handle a regular pasta if I'm out and that option is not there. Like I've worked on that gut healing enough where now I did have H. pylori like out the roof. So, you know, that's a whole nother thing for another day. But, you know, I did have other markers that could have been drivers behind my Hashimoto's besides a true gluten issue.
We should definitely do another episode where we talk just about gut health because I think this is just such a fascinating topic. And
for sure.
The gluten controversy. Yeah, that's another one of the, so I have a book that's coming out too. And one of the things in it is about how I was disillusioned with traditional healthcare, how I got into the functional medicine, but things along the way. So my son, this is an extreme gluten story. My son, when he was just out of high school, attempted some self-harm because his gut was so bad. And he thought they had stomach cancer and we weren't telling him. He was losing weight. He was miserable. I mean, and this is a kid just right out of high school. So he should feel like $1 million, right? But he was so just miserable. And he, like I said, he was panicking that the worst thing was wrong with him and nobody would tell him. And so he was not going to live like that. Thank goodness he survived. He's still here. But one of the things that I advocate to people is things like that, you don't know. And you're going to have people that go, well, gluten's nothing. Like it's not really a thing, but it is. This boy was so sick. And we finally got him off the gluten. We did the GI map. I found the H. pylori, found, the gluten intolerance, all the things. And he now is like a bodybuilder and like he's so strong and he's got a wonderful family and like everything worked out well. But a true celiac, as you know, is like a hereditary thing. His father unfortunately died at the age of 52. And now when we look back, we think, wow, he probably had celiac and nobody ever listened enough to find it. And I feel horrible because I didn't know enough.
Right.
Then, now that I've done functional medicine and the training, I'm like, wow, we could have potentially saved him. But the point of that all is to never take for granted your symptoms. Always advocate for yourself. And if something isn't right, it isn't right. And find somebody who's going to listen to you.
Yeah.
Somebody who's going to track it down. Because you said you felt horrible. Your gut, you fixed your gut, and now you're like feeling it. No, we're not going to say cured your Hashimoto's. I know you don't want people to say, you don't want to get false. But there's so much information in that gut test that just will blow your mind and give you so many answers, which is why now I go, just wait. I used to think, oh, I know. I've got an idea of what it is before I order the test, and I think I know what it's going to show. And then the gut test comes back, and I go, whoa, didn't see that one coming.
Mm-hmm.
That's what I love about it. I love a puzzle. Love a puzzle. So you are in a private practice,
Yes.
which gives you a lot of leeway. What would you say to other nurse practitioners who are interested in being outside of like the big hospital systems and thinking about private practice?
I don't want to say I will never go back because heaven forbid, I never want to go back. Let me put it that way, because I am not held to standards set by people who have no idea anything about medicine. I get to advocate for my patients, my supervising physician. So Georgia is not a full practice state. So Georgia is a very restricted state. It's one of the most far behind in nurse practitioners' autonomy. It's horrible. Luckily, I have a fantastic supervising physician who tells me, you did the specialty. You know what you're talking about. I trust you. Order what you want to on these patients. And so if I have to ask him questions, there are some days where I have to teach him things because he is in this conventional model, right? And so he knows conventional medicine. He trusts me to know my realm of medicine and to know conventional medicine and when to blend the two. And so, but again, he is not part of this corporate medicine. And I feel like my soapbox has always been with this. Doctors are not inherently bad. They work in a broken system. They work in a system where you have to see patients every 5-10 minutes. You work in the system where you are dictated that you have to see this many patients a day or else. You are incentivized for seeing more patients because RVUs pay. And I've never worked at a job where I got paid RVUs because I would have not ever had to work again if so, because I've always just in hospital medicine, I am a fast-paced person in a hospital medicine setting. But here I get to slow down because I have to be fast there. I don't have to be fast here. And I get to slow down. I get to ask those questions. I get to be present and I get to just be an advocate for people. And if you are looking at getting out of that conventional realm or the healthcare corporate realm into private practice, like just take the leap and do it, because there are so many people that are failed by that system and they need somebody that can take the time for them and be that person for them, because there's only one of me. There's only one of you. There's only one of everybody. And so if we can all collectively work together,
Yes.
for the benefit for our patients, like we will no longer have a healthcare crisis. Like if we can address the root causes, we have the sickest people in our nation right now, and nobody's fighting for them. Very few people are fighting for them because the corporate medicine has taken over the world.
Yeah.
And so when you step out of that conventional realm, when you step out and you dare to be that person that can reason with these patients and that you can advocate for these patients, that is our job. We are patient advocates. And without getting political is not the right word, but the whole Lindsay Clancy trial that's going on right now, like her nurse, when she was on the stand yesterday, was like, it is my job to be a patient advocate. That is why I was in the room when these doctors were in the room, is because I'm my patient's advocate. That is me. I'm your advocate. I'm your advocate with the insurance companies if we have to fight that. I'm your advocate because I treat you. They don't treat you.
Right.
And so that is the thing. That is why the primary care I worked for before, I will not go into that. If you know me, you know where I came from. But the primary care that I worked in before was run by pharmacists. Pharmacists are great. Pharmacists do a great job. Pharmacists should not be running a medical clinic. And that is why so many things about that clinic failed, is because you have people who shouldn't be running medical clinics. You have people who shouldn't be running healthcare facilities dictating, do this, do this, do this, do this. And it makes zero sense.
So you're saying your quality of life is way better now.
It is. Yeah.
And yeah, I'm so passionate about it also. I'm like you. I hope to never have to go back into a hospital system. It makes me ill to think about ever having to go back into that rat race because it's getting worse. It's getting worse with the big systems buying up everybody. And I know that a lot of nurse practitioners are kind of scared and kind of nervous about it, don't know where to start. And there's resources. I mean, yes, I'm one of those resources, but you don't have to do it alone. You don't have to have a functional medicine degree, honestly, to even do it also. You just need good mentorship, you need, good education and a passion to help. Like all of it matters. But if you could design the perfect healthcare system, what would it be?
I would order GI maps on everybody. Because I think gut health is, and one day I hope to be able to see patients, obviously not everybody, but I hope to be able to see patients in a pro bono manner because so many people deserve what I can offer, but not everybody can afford it. And I don't know, obviously I'm, not a millionaire. I can't just go working with everybody and I can't just afford to front everybody. But like, what happens if you make a difference in one person's life? And that one person goes and tells their friend, and then that one friend tells their 3 friends, and then those 3 friends tell their 10 friends. Like, think of the profound impact we could make by just helping one person. And even generations to come. Let's say that mom is struggling mental health wise, and she's got all these neurotransmitters that are abnormal, or she's got this hormone issue, or she's got this gut issue, and she can't be the mom that she wants to be. And so she's snapping at her kids. Well, imagine if we, and I don't want to say fix that mom because I don't that's not the right word I'm looking for, but imagine if we address what is going on with her and how that could change the trajectory for her family and for the families to come after that. Like, there's so much that can be done by helping one person. And so if I could design the perfect healthcare realm and the perfect healthcare system, it would be patients that took time with their providers, or the providers that took time with their patients, rather. No more 5 to 10 minute visits, minimum 30 minutes for a primary care patient, an hour longer for functional medicine patients, and GI maps for everybody. And insulin numbers and ApoB numbers and LPA numbers and
A full panel.
Yeah.
Yes.
Full thyroid numbers, not just a TSH.
Oh my gosh.
That's a whole nother soapbox for another day.
That is definitely also another. So I'm kind of with you on that when you said earlier, and I know we got to wrap this up, but when you said you were looking and everything was like $5,000, $6,000, do you think that there is a way to make this more affordable if we get the collective on board?
I do, because, right now there are so many people that, again, my husband and I make good money. I could not afford that. And there are so many people who can't afford that. So then they just suffer and they just feel like they're supposed to feel this way. And so, yeah, I think that there is a way to make things affordable. And I'm still figuring that out too. I'm not, I feel like every time I turn around, like there's something to change. There's something that can be better. There's something that, I could do differently, but I'm learning as I go too. Like I'm not this like fantastic businesswoman that has it all figured out. I'm not this, there are things that can be done, but I'm learning too.
I with you. Yeah. I mean, I absolutely love this. I know, like I said, we got to wrap this up. Kacie, I definitely hope you come back because we're going to
Yes.
talk all about guts and all the thing. And I think so many women are going to, get benefit out of this as well as nurse practitioners, which is what I want. I want. I mean, there's so many places I want to bring this into also. And when I started this, it was because, okay, I can't help everyone. Just like you said, you can't see everyone. We're in different states. There's so many people. But the more nurse practitioners we get on board with this, the more people we're going to help. And then, jumping into, I don't know that we'll ever change insurance companies, but maybe corporate areas. But anyway, there's lots and lots of wonderful things to be done. But thank you so, so much for being here. It's been a pleasure. And I love that your message isn't just about that division in healthcare, but it's about creating a better one. That future that isn't just conventional versus functional medicine. We're all in this together and we all have something we do. Like we all have a role to play in this to help. So it's providers who are willing to listen, ask better questions, and bring together the best of both worlds for the people they're privileged to serve. And I truly believe that nurse practitioners are uniquely positioned to lead this transformation. So again, thanks everyone who joined us on the Next Level podcast today. If today's conversation encouraged you or challenged your thinking or maybe stimulated you that there's another way, please subscribe, share this episode, leave a review. I'd love to hear your comments, how you feel about this as whether the patient or the practitioner. And if you're a nurse practitioner who's ready to practice with more confidence, purpose, or freedom, I'd love to invite you to explore Next Level MP. It's at nextlevelmp.com, easy to remember. Together, we're transforming women's healthcare, one provider, one patient, and one conversation at a time. So until next time, never stop asking why, never stop advocating for yourself or your patients, and remember that the story matters. So thank you so much.